To Tidbits, and today we'll be talking about not quite a little tidbit, but the most relevant topic of this crazy, chaotic year. If you guessed coronavirus, you were bang on. Coronavirus and COVID vaccines have been the talk of the town for quite a while now, and with the global cases steadily on the rise and months of, well, let's just put it as not having a normal life, a vaccine for the highly contagious viral infection cannot come sooner. It is quite possibly the most eagerly awaited thing of this decade. With that being said, there's also a lot of questions and confusions regarding this issue. And to answer a few of them, today we have Ms. Janani Srinivasan Vasudevan, a microbiologist currently working on a coronavirus research project. Good morning, ma'am.
Good morning.
So, before we get into the crux of this interview, could you please give us a brief introduction of yourself and about your work?
Thank you for the warm welcome, Harini. So, to give you a brief insight into what we are working on, it's basically trying to understand the integrative genomics of SARS coronavirus 2, which is the virus which is causing the current pandemic. The information we are trying to obtain is from the perspective of the virus, in the sense that what's happening to the virus genomically, whether different areas within the country have different form of the virus or different strains of the virus, and also from the perspective of the human, that is the host, in the sense that if certain population of groups or certain kind of people from different ethnic groups are more accustomed to the virus, meaning that they have some kind of protectivity, or in the sense that whether they are more prone to get a disease or get a severe disease of the same, as we all know that it causes a different range of the disease as well. So that's the work we are currently trying to work on.
Thank you, ma'am. Moving on. So, one of the most frequently asked questions is that what exactly is the difference between coronavirus, COVID 19, and SARS CoV 2? So, what is it?
Well, that's an interesting as well as an important question. So let's begin with what's a coronavirus. Coronavirus is a RNA virus which of a zoonotic origin which infects humans. The virus is usually known to cause lower respiratory tract infections, meaning cold, which is also caused by other viruses. There are many different types of coronaviruses which has come in this decade and has caused previous pandemics such as the SARS-CoV, MERS-CoV, as well as the current pandemic which is the SARS-CoV-2. So all these viruses are coronaviruses but of different strains and of different genuses. To explain more further into what's the difference between SARS-CoV-2 and COVID-19 is SARS-CoV-2 is the infectious agent, which is the virus named as the severe acute respiratory syndrome coronavirus 2, which causes the disease that is COVID-19, which is coronavirus disease 2019. The naming is difference between the nomenclature of the infectious disease as well as the disease itself, if that clears it up for you guys.
Yes, it does. So, there's been news about the SARS CoV 2 mutating, and I just wanted to know if it was true. And does that mean that it's mutating to become more deadly?
Okay, so this is going to be a long answer, so bear with me and let me know if you need any inputs, and ask me to stop whenever you're not able to understand a certain thing.
Sure, ma'am.
Okay, so for this question to be answered correctly, maybe I should give you a brief introduction of what happens to a virus. So, generally, it's a natural evolution process for a virus, or for that matter, even as human beings. We genetically keep modifying ourselves to have a better evolutionary progress and to withstand different conditions. So, to be very fair, the virus is of course mutating. It's not just the SARS-CoV-2 virus which is mutating. In general, all viruses also mutate. But yes, SARS coronavirus 2 is mutating, and recently there have been findings identifying that the virus is mutating towards better transmission, in the sense that there have been identified certain mutation by a research group. The mutation is called as the D614G mutation in the viral spike protein, which is very famous right now and is one of the hot topics in the research scientific community. So basically, this particular mutation increases the viral transmissibility, meaning that chances of the transmission of a virus from me to another person is much more, as well as within myself the amount of infection which it might create is also increased. This is a very preliminary finding, but there are more research groups working on it, and maybe we'll have better information in the coming time on this.
So, on the topic of transmission, say if I were to catch coronavirus or SARS CoV 2, is it possible for me to get it again?
Okay, I guess you're trying to ask me if it's possible for a person to get a reinfection, meaning a person is already infected with SARS-CoV-2 or COVID-19 and has cleared the disease, and after a few months is able to reinfect himself or herself.
Yes.
Yes, it is possible. Actually, one of the recent findings of our project was of this, wherein in a case of healthcare workers working in Mumbai, we found that there was a case of reinfection. Not just one, but three healthcare workers had reacquired the coronavirus disease, and the disease was a little bit different in the sense that in the first episode of the disease they were symptomatic, while in the second case they were showing even more symptoms than in the first case. Also, within our institute, and another group of research team has found that, contradicting to our work, they have found that in the secondary case of infection they were in asymptomatic. So yes, it is quite possible for a person to be catching the disease once again.
Oh, yes. So while I was doing a little research on you for this interview, I realized that this was actually published by Times of India. Congratulations on that, by the way.
Thank you.
Continuing forward, studies have shown that some groups are more vulnerable to the virus than others. Can you enlighten us a little about that, considering that your work is closely related to this?
Okay, so to answer this question, studies have indeed shown that certain groups are more vulnerable. When we mean certain groups over here, it would be that of people having comorbidities. When I mean comorbidity over here, is that if they are have pre-existingly having disorders such as diabetes mellitus, which is commonly known as diabetes, or patients having sugar in India, people with hypertension, people with cardiovascular diseases, people with chronic kidney diseases are more prone to get the coronavirus, as well as the fact that they might have a severe outcome of the disease as well. Give you guys a better understanding, if I say that a person with no comorbidities get an infection, there is a high chance of that person clearing out the infections while remaining asymptomatic or having very mild symptoms, needing meaning they don't require a hospital admission. While if a person with the said comorbidities acquire the infection, there's a high possibility of them having severe infections, developing a condition called ARDS, which is acute respiratory distress syndrome, in which case patients would be requiring hospital admission as well as ICU treatment.
So, now that we have a little more information about the disease and the virus, let's move on to the topic of tests. So, what are the different tests that are available for COVID 19 and how does the testing process differ?
On the topic of testing, there are three types of tests which are being currently conducted in India. One is the rapid antigen test, second is the rapid antibody test, and third is the confirmatory and the gold standard RT-PCR test. So, the sampling process for two of these tests, that is the rapid antigen test as well as the confirmatory RT-PCR test, remain the same. At the collection center, a nasal swab as well as an oral swab is collected from the patient and is then transported to the testing laboratory. Once the sample is received in the viral transport medium, viral RNA extraction takes place, wherein the virus is inactivated and then the RNA is extracted for further processing. So in the rapid antigen test, you'll be getting the results within the next 15-20 minutes, wherein in the confirmatory RT-PCR test, once the RNA is extracted, downstream processing is conducted and you'll be getting the results within the 24 hours.
So, how is the antibody test different from the tests that you were speaking about? And who should get the antibody test, and what are the benefits of getting one?
So for the two tests which we previously spoke about, where the sample was the nasal or the oral swab, we are testing for the virus. In the case of the antibody test, we are testing for the antibodies which are produced against the virus by the humans. While who should get tested for antibody, I think if everything goes well, and an idealistic nature in me says that everyone should be getting tested for the serum. Basically, it will give us the information that how much of the population has come across the virus. That would give us an idea about the viral penetration as well as the exposure of the virus towards the humans. And for the third test, which is the rapid antibody test, blood sample is collected from the patient, and then the serum is tested for antibodies which are produced against the virus. So even though you don't have the viral infection currently in you, it is possible for you to test positive again for the antibody which you would have acquired when you first encountered the virus.
And lastly, and a very important question, given all the news and buzz about the vaccine and the rising worry amongst the people about its repercussions due to the rushed trials and political push for results, in your opinion, is it okay to expedite vaccine development? And further on, will the vaccine solve the COVID issue for good?
Is it rushed? Yes. Is it necessary? That would also be an yes. Given the astronomical impact of the coronavirus disease among the global population, there is a need for a positive reinforcement, and I think the vaccines would be an answer towards that. To answer the question whether the expedition of the vaccine is justified, the scientific community is polarized on this. In my personal opinion, I guess if we get it right, vaccine would solve a lot of issues for us. But in the long term, that might be a very dicey situation to be in. Because even though we know that the vaccine would be safe and would have an immunity against the virus, do we know whether it is not going to be toxic, in the sense that whether the genotoxicity won't be taken forward into the next generation, because those tests cannot be expedited. Also, given that the virus is continuously mutating, are we sure the vaccine which we are going to take is going to give us protectivity against the future mutated virus? An example of that would be the flu shots. Every season we do take flu shots against particular viruses in that season, but the next season it is rendered useless. So how many booster shots would we be requiring? Those things are not going to be calculated within the short expedited process time. So yeah, maybe not a long term solution, but a much needed one right now.
Only the future holds the answer towards this, I guess. So we shall wait and see. Thank you for sharing the pearls of wisdom, ma'am, and for bearing with me through this interview.
You're most welcome and always happy to help.
And thank you guys for listening in. Until next time.